Hello, my name is Eric Woolley, and this is my presentation on vaccine hesitancy. So, what is vaccine hesitancy? Vaccine hesitancy is the refusal or the delay in taking vaccines even when they have already been proven to be safe and are available to take. The World Health Organization has identified vaccine hesitancy as a major global health threat. Hesitancy can be influenced by things such as fear, misinformation, cultural beliefs, or just distrust in institutions or the government as a whole. It's not always the flat out refusal, but some people are just misinformed and will delay taking it until they are educated on the matter. Why is this important? This is important because historically vaccines have been able to prevent or flat out stop diseases such as measles, polio, influenza, and COVID-19. And the vaccine doesn't just protect the person, but it protects communities through something called herd immunity, which herd immunity is when most of the people in a community are vaccinated, so the disease cannot spread through the community. Rather, it could spread through households, but not through the entire community. And also, declining vaccination rates have led to outbreaks and can lead to outbreaks of preventable diseases such as the ones listed earlier. Some major causes are the spread of misinformation on social media, which is arguably the biggest cause because a lot of people who are uneducated about the matter will head to social media and there's a lot of misinformation which they will believe, and this misinformation causes fear, which the fear of the side effects could cause concerns about the vaccine's safety, which if somebody has concerns, then they probably won't take it, even if the concerns aren't necessarily as bad as the sickness itself. They don't want to take that risk. And then this fear can cause general distrust in the pharmaceutical companies or the government, which is awful for healthcare and healthcare as a whole, and also just religious or personal beliefs and lack of healthcare access and education, which, like I mentioned before, education or lack of education causes a lot of people to go to social media for their information. So latest trends and statistics are childhood vaccination rates have declined in many countries post COVID-19, and the CDC has reported increases in measles outbreaks linked to low vaccination rates, especially after the the COVID-19 pandemic. Social media platforms have contributed to the rapid spread of vaccine misinformation, and younger adults, who are the main consumer of social media, are more likely to question vaccine safety compared to older generations. And this is also because the older generations have been doing this their entire life, and they've lived through a lot of outbreaks, so they understand the importance of vaccines and vaccinations, versus the younger adults who who've lived through COVID, but they haven't lived through as many, so they might be like, we don't need these vaccines. COVID-19 had a large effect on vaccine hesitancy, because the pandemic happened so fast, and then the vaccine came out so fast that people thought it might have been developed too quickly, and that there would be major side effects, or that it hasn't been tested properly. And then this caused concern about other vaccines. So then they thought that it might have been a whole institutional problem, which, and then it was so politically charged that it was, if you're either on one side where you take it, or you're on one side where you don't, and then it became a whole political debate. But public health agencies have been able to improve trust through things such as educational campaigns. Short-term consequences. Some of the short-term consequences are higher risk of disease and outbreaks, or outbreaks of disease in schools and then communities. And these outbreaks would cause increased hospitalizations, which would increase healthcare costs, which would put pressure on the healthcare systems during those outbreaks, which would increase heavily. And then the spread of these illnesses amongst the elderly and the young, who are very vulnerable to diseases like this, or diseases that could be prevented. Some long-term consequences, which are much more serious, are the return of diseases like measles and polio, which have been under control since the vaccines for them came out. And also, vaccine hesitancy would cause lower trust in public health institutions as a whole. And some of the diseases could cause long-term health complications like polio, which causes post-polio syndrome, or it has a 40% chance of happening, which is when like 15 to 40 years after you get it, you could develop it, and it's like you start getting fatigue, muscle weakness, you just hurt, your ligaments hurt, and that could be prevented with the vaccine. And also, the increase of sick people would cause more economic costs from healthcare treatment, and a loss of productivity, because they would have to assign more labor to take care of these people. Some positive actions and solutions are to improve public education about the vaccines with accurate scientific information. Also to encourage healthcare providers to discuss any concerns in a respectful manner, and to increase transparency about the development of the vaccine and any side effects that may happen, to get those out there so people are aware. And it's always better to hear it from a healthcare professional rather than somebody online, which could be misinformation, or just it could be phrased in a certain way. And also expand access to vaccines in communities who haven't been able to get it. Why do these actions matter? These actions matter because the more educated somebody is on a subject, the more likely they are to make their own decision rather than just what they have read or what they have seen or what they've heard. And also, the trust improves public health cooperation, and the vaccines, due to herd immunity, protects both individuals and the communities that they're in. And strong vaccination programs would reduce death and therefore healthcare costs. Finally, vaccine hesitancy is still a major public health challenge and concern. Misinformation and distrust have contributed to declining vaccination rates, especially from social media and people who are not educated on the matter. Education, transparency, and healthcare access can reduce hesitancy, and communities benefit when vaccine rates remain high due to herd immunity. And finally, these are the references I used for this presentation. Thank you.